After we have known the areas, the sensitive areas, and what is the difference between retching and gag reflex, we need to know what causes it. There are some physical causes or reasons, and we have psychological reasons. Physical reasons are approaching these sensitive areas. It could be also some olfactory senses, some smells cause some gag reflex. Sometimes it's an auditory. It's very strange, but some sounds, some tastes also produce this reflex. The psychology behind it is almost related with anxiety, insecurity, and sometimes we have other psychological problems that have gag reflex. So these are the reasons, and how we deal with these issues. I'll try to put in the description two papers that I found very useful to describe the issues we're going to talk. The gag reflex is something natural. First of all, if I'm going to talk about the managements, I need to know, my first is, what is the gag reflex index? The index is meaning that the gag reflex, how severe it is. It runs from 1 till 5. Okay, it has grades in it, and you will find it in the reference. But the idea, number 5 is the most severe case, where any approach to the oral cavity, they will have a severe gag reflex. We have also called something called gag reflex protective index, where can I produce dental procedure or not? They also run from 1 to 5, and you can scale your patient towards them. But these are outliers. These are cases that are outliers. They don't occur very regularly in our clinics, and if they do, maybe in 10 years you'll see 1 or 2 patients only in this case, a severe case. So let's talk about the majority of the people, which lie in 1, 2, and 3 severity ranges. So what do we do to prevent gag reflex in our clinics? 1. We have, first of all, conventional methods. What are our conventional methods? What I mean by conventional methods are methods that are done for all patients. These are not related to specific patients. These are done general for all patients. We usually, when we do our work, we usually begin by trying the trays. The trying of the trays, the trial of the trays, allows the patient to expect what they're going to feel when the impressions are there. Although it doesn't give them the full feeling, but it does work at sometimes. The way we mix our material according to proportions. These proportions ensure that the material is not very fluid and will not flow to unwanted areas. The way we use a tray and press from back to front will reduce the amount of material flowing into the outside. Even when we load the tray, the loading of the tray, we load the tray where we apply the material in the center and we spread it, and we also spread it over the edges. The spreading over the edges guides the flow of the material under pressure to the edges more than going posteriorly. And even I tell my students in the clinics, whenever going to take an impression, please place 2 utility wax as an arch in the back to work like a pose down, preventing the material from flowing backwards in the throat. This will reduce the amount of flow in the soft palate area, and it will guide the material to go to the sides. Okay, and also we have the use of an adhesive. The adhesive confines our material inside the tray. The amount of material we load different amounts. So if we have a gag reflex and we're going to do the upper only for the purpose of bite registration, we could only load the material like a horseshoe shape without loading the palate. The time we spend we keep it as minimum as possible. We could use fast setting material. We could use accelerators for the impression material to reduce the time we spend inside the patient's mouth. During that time, we use the suction to take away any excess saliva, because most of the patients that we have in our cases, the accumulation of the saliva without an efficient suction will cause the disruption of the patient not knowing do they swallow or do they keep the material inside their mouth, or what to do. So the suction, effective suction during the impression procedures are important. Definitely when we try the trays and we find that our patient is agitated or has some stress, we always do some assurance. We try to reduce stress, and we try to distract them by talking. We open beautiful and happy subjects to work around. Also, we could do nasal breathing. We could do it during the impressions, during the trials. We begin trying and instructing the patient to do nasal breathing, where the air goes in and out the nose. And most probably, the patient will have reduced gag reflex when they guide their breathing to the nasal breathing. Okay. Sometimes all of this doesn't work. We are inside impression, or we're in the middle of the impression, and the patient takes it out even before setting. They don't allow you to continue. They stop you from distracting them. You tell them move the hand, move the leg, whatever you're saying during the conventional methods. They stop everything and they force the tray out, and they don't let you complete working. So what are extra measurements? Extra measurements, we usually say non-invasive, invasive methods, meaning no medications, no interferences, or traditional medicines to do this. For a non-invasive procedure that I found that many of my colleagues are using is to use salt particles. They sprinkle over the tongue amount of salt particles. Then they ask the patient to rub it against the hard palate and the soft palate. So rub this salt back and forth until the patient feels the sting of the sharp, salty taste. What happens actually, this will drag the saliva out, the soft tissue. Sorry, not the saliva. Actually, the fluids even in the soft tissue. It partially dehydrates the soft tissue. This will reduce the sensitivity of the neurons, okay? So reduction of the sensitivity will produce an anti-gag reflex effect. This also could be achieved by icy water. You bring up a glass of water, you place ice cubes in them, and then you fill it with regular water, and you wait until it's chilled out. This chilled out with ice cubes in, this water is in a temperature where it produces paresthesia from the cold, the deep cold that the patient feels inside their mouth. Another way is to wipe topical anesthesia. Topical anesthesia comes as a cream, and we've used it in pediatric dentistry. That cream, you could use it in the soft palate area, and even I found some papers recommending wiping all of the inside of the mouth using these topical anesthesias. So those also work. There are more advanced a bit where we do some invasion, where we can do local anesthesia of the lesser palatine nerve. Okay, this is a bit crucial to be done in a place where you can provide oxygen in case the patient had any reaction or any obstruction of the airways, because the lesser palatine nerve, if it doesn't only control the gag reflex sensitivity, but also it will might interfere with the swallowing, because we know that the swallowing has a trigger. So the patient doesn't feel the trigger for the swallowing, they could choke on fluid flowing into their mouth suddenly. Another method that they recommend is in traditional medicine, and these are usually related to Chinese medicine, where they recommend using acupuncture. Acupuncture is related to the area. These are specific points where they place a small pin, and they will produce neural discharge that will overcome other sensations. So these acupuncture points, we're going to talk about them. Some of them talk about acupressure. It's not, you don't need to place a needle there. You are only you're good to be satisfied with placing your finger with firm pressure over it, and that will work very well. It could be massage. You can massage that area and also produce that effect, those effects. What are these areas? Even laser, low energy laser placed on these acupressure points will also produce this. I found some papers talking about that. Where are these points? We have one point is the P6 point, which is over the rest by 3 fingers. It's almost here in the depression between the vasculature. Okay, we have another point in the middle of the hand, and it's called the palm pressure Li Gong point. There is another pressure area recommended in between the web between the index and the thumb. There is the web here, not the skinny one, but the fleshy part. There is an area of pressure here where also they talk about pressurizing it. It's called the Higo point. And then we have another one in between the lower lip and the chin. Okay, here in this depression. This is another point. They call it a CV24 point. Okay, there is another point in the external ear. Okay, and this is the tragus in the ear. There is this is the band of skin, like a fold of skin. It's almost here in the external ear, and this is called TB21. It's over the tragus area. So these areas, if you apply acupuncture with a needle or pressure or massage or laser, low grade laser, they found that they reduce the gag reflex. But all of these are going into distraction. They could be neural distraction if you're doing the actual puncture, or you are triggering the nerves to send flashes by pressure and massaging them. All of these come in the distraction phase. So the distractions in specific points or distractions during talking. We said we are going to talk to the patient as conventional methods. So while speaking to the patient, it's a type of distraction. Okay. Then we have other techniques that are written. They call it finger massage. Massage. This is done for the soft, for going in, sending this as a homework. This is a homework for the patient to do, where you send the patient and you instruct them, please, these are the teeth, and this is the hard palate behind it, and up to the soft palate here. Okay, you tell the patient, please insert your finger. Okay, with your finger, go in and try to rub and see how much far can you go, and each time try to rub more and more behind. So it's a take-home exam that you give homework to you. The patient examines how much can they go further in without reproducing the gag reflex. There is another one with even they combine it with 7 visits. They need 7 visits at the clinic where they use marbles. You know the glass balls, marbles. You place marbles inside the patient's mouth, and you instruct them to place a different amount each time, and you begin trial with the trial bases as well. Towards visit 4 and 5, you use trial bases, and then you do insertion of the lower only denture, of the lower denture only. These are methods, these called marble technique. So these are used usually and left for the very, very severe gaggers and you want to manage them without any medications. But all of these are for patients we could deal with. More patients we could not deal with, we're going to go for medicaments. What are the medicaments we use? They could be antiemetic, they could be nitrous oxide sedation, they could be antihistamine sedations. These are sedations. We could go for general anesthesia sometimes. Some patients we might perform our work with general anesthesia. There are more extreme cases where sometimes if the gag reflex is interfering with life functions, sometimes they could go and block the nerve. These are very advanced. They could do it in oral maxillofacial surgeons do them, where they block some of the nerves. They reduce away where they block these nerves by some injections to reduce the sensitivity. But this is very severe, and hopefully we do not use it. We can satisfy ourselves with this range, and or find someone who could do it for us, or at least go for GA for our dental procedures. So this is the gag reflex in English, and hope it was useful for you. Thank you.